What if you have been told that you can't have the very procedure that was meant to give you hope? I'm talking about the all-on-4 procedure, the one often described as a life-saving solution for people with bone loss or very minimal bone. For most people, it works beautifully, but about 10% of my patients I see fall into a different category. They've gone to other clinics hoping for an all-on-4, only to be told that they can't have it because their bone loss is too severe. Some have almost no upper jaw bone left at all due to years of resorption. Others have endured years of dental infections, often because of their fear, resulting in significant amount of bone loss by the time they seek help. Imagine being told again and again that, sorry, you're not suitable. You walk out of the clinic feeling like you've run out of options. That sense of despair is something I see too often. But here's what I want you to know. You don't lose hope, because there's still a way forward through something called zygomatic implants. And this isn't just another implant procedure. This is the ultimate solution when all other options have failed. Hi, I'm Dr. Wilfred Koon from The Point Dental here in Melbourne. Every week, I meet people who have been told they are too difficult or they are not suitable for dental implants. And yet, we are able to give them back their smile, their ability to eat, and most importantly, their confidence. Zygomatic implants are often our final, most advanced option to restore fixed permanent teeth, and they require absolute precision to get right. Now, the name might sound intimidating, but let me break it down simply. Most implants are placed into the jawbone, but when the jawbone is too thin or too weak, we have another option. We place implants into the cheekbone, also called the zygoma. Here's the surprising part. Your cheekbone is one of the strongest and most reliable bone in your body. So even if your upper jaw has almost no bone left, we can still place implants securely. Now think of it this way. Your jawbone can wear away over time, like sand eroding on a beach. But your cheekbone is like solid rock. It stays strong and dependable. And that's why it can support implants even when the jawbone can't. Technically, this is a very complex procedure. The implant is much longer than the standard implants, and they travel from the inside of your mouth up all the way to your cheekbone. The trajectory has to be exact. There's no margin for error, and we use 3D planning and advanced surgical protocols to ensure the millimeter perfect accuracy. This is why zygomatic implants should only be done by experienced surgeons in a well-equipped center. I'll never forget one of my patients, Miley. She had been told by 3 different dentists that implants were impossible. She was devastated. Eating was painful, and socially, she felt invisible. When I explained zygomatic implants to her, she cried. Not out of fear, but out of relief, because finally there was hope. Today, she got her smile back. She eats confidently, she laughs freely, her whole life has changed. This is why I love zygomatic implants. Not just because of the science, but because of the hope they bring. Another patient of mine was told that the only way he could get implants was to go through extensive bone grafting, including harvesting bones from his hip to rebuild his upper jawbone. He was so convinced that he could never smile naturally again. But with zygomatic implants, we were able to rebuild not just his teeth, but his confidence. When he came back for his checkup, his wife told me, "Thank you for giving me my husband back." Moments like this remind me it's not just about teeth, it's about restoring lives. Now, I know what you might be thinking. This sounds scary, and you're right to feel that way. Almost every patient I see for this procedure feels nervous, not just because of the surgery, but also whether or not it will actually work. So let me answer the 3 biggest questions patients ask me. Number 1, is it painful? Most patients are surprised. With modern minimally invasive zygomatic techniques and general anesthesia, this procedure is actually quite comfortable, and the recovery is much smoother than most people expect. Number 2, will it last? Yes, zygomatic implants have been studied for decades, and success rates are extremely high, even in patients with severe bone loss. Number 3, will it look natural? Absolutely. The implants are hidden under your new teeth, and the final smile is designed to look and feel exactly like your natural teeth. Put it this way, if we don't tell you whether or not you're getting standard all-on-4 dental implants in your upper jawbone, or you are getting zygomatic implants in your cheekbone, after the surgery, you wouldn't even know the difference. The recovery, the discomfort, the teeth, the way you function are exactly the same. And here's something unique about us. At The Point Dental, there's no such thing as a case that cannot be treated. Your treatment is never limited by our technical skills or by our implants inventory. We have the training, the experience, and the full range of implant solutions from all-on-4 to zygomatic to advanced reconstructive options. In fact, in Australia, only a handful of clinics have the skills, trainings, and the surgical infrastructures to offer zygomatic implants safely. When you come to us, you can be confident that you're receiving one of the most advanced implant solutions available anywhere in the country. That means even if you have been told elsewhere, sorry, nothing can be done, we can almost always find a solution for you. Your situation isn't hopeless. You're not too difficult. You simply need the right approach and the right team. One of the most incredible things about this procedure is how quickly it can change your life. In many cases, patients can walk in with no teeth and walk out on the very same day or within a few days with a brand new smile fixed to their implants. But make no mistake, this is a procedure that requires absolute focus and precision from the surgical team. We plan every step in advance, down to the last millimeter, because accuracy is what ensures long-term success and safety. I've seen patients come in hiding their faces and leave looking 10 years younger, smiling ear to ear. It's not just life-changing, it's instant. Take John, for example. He had worn dentures for over 20 years. He couldn't eat steak, he couldn't bite into apples, and he hated how his denture moved when he spoke. When he learned that zygomatic implants meant he could finally have fixed teeth again, even after all those years, he almost didn't believe me. When he came back for his follow-up, he told me, for the first time in decades, I feel like myself again. And that's the power of this treatment. So, if you have been told you don't have enough bone for implants, if you have been living with dentures and thinking there's no way forward, or if you've been told that you're not suitable for all-on-4, please know that there's still hope. Zygomatic implants may be the solution that you've been searching for. If you found this video useful, please give it a thumbs up and share it with someone who needs to hear that hope is still possible. And if you'd like to learn more or even see if you're suitable, feel free to reach out. We're always here to help, because at the end of the day, it's not just about teeth. It's about giving back people their freedom, their joy, and their smile. Thanks for watching, and I'll see you in the next video.